Good day everyone! For this week's respiratory system laboratory activity, I'll be discussing and demonstrating cardiopulmonary resuscitation or CPR. One of the most important life-saving procedures in emergencies. What is CPR? Cardiopulmonary resuscitation or CPR is an emergency procedure performed when a person's heart suddenly stops beating. It combines chest compressions and rescue breaths to keep oxygen-rich blood flowing to the brain and other vital organs until professional help arrives. Where is CPR applicable? CPR is applicable in any situation where a person's heart or breathing has stopped. CPR is also essential during emergencies such as drowning, choking, and electric shock. CPR can be performed almost anywhere. It can be at home, in school, at work, or in public. It is used when a person stops breathing or their heart stops due to emergencies such as drowning, choking, or electrocution. When to perform CPR? Start CPR if the person is unresponsive or unconscious. Begin if the person is not breathing or only gasping for air, and perform CPR immediately if there is no detectable pulse. You should perform CPR if the person is unconscious, not breathing normally, or has no pulse. Remember that every second without CPR reduces person's chance of survival. There are two main types of CPR. First, the hands-only CPR, which involves chest compressions only. It is best for untrained individuals. Second is the traditional CPR, which combines compressions and rescue breaths and is usually done by trained rescuers. Importance of CPR. CPR is important because it keeps oxygen-rich blood moving through the body until help arrives. According to the American Heart Association, performing CPR immediately can double or even triple a person's survival rate. Now let's move on to the step-by-step CPR process. Step 1 is to make sure the scene is safe for you and the victim. Then tap their shoulders and ask loudly, "Are you okay?" If there's no response, move to the next step. Step 2 is to call for help. Dial your local emergency hotline and if possible, ask someone to bring automated external defibrillator. Step 3. Check if the person is breathing or has a pulse. Look, listen, and feel up to 10 seconds only. If they're not breathing normally or have no pulse, start CPR right away. For step 4, perform chest compressions. Place your hands on the center of the chest and push down about 2 inches at a rate of 100 to 120 per minute, roughly the beat of staying alive. Allow the chest to rise completely between pushes. Step 5. After every 30 compressions, give 2 rescue breaths. Tilt the person's head, lift the chin, and pinch the nose. Blow for 1 second and check for chest rise. Step 6. If there's an AED available, turn it on and follow its voice prompts. Attach the pads to the upper right chest and lower left side. Ensure that no one is touching the person before a shock is delivered. Step 7. Keep repeating 30 compressions and 2 breaths until the person shows signs of life, an AED takes over, or medical help arrives. Stop only if you're physically too exhausted. In special cases, the steps are slightly adjusted. For infants and children, push about 1/3 of the chest's depth. For pregnant victims, tilt slightly left to ease pressure on veins. And for drowning victims, always begin with rescue breaths before compressions. Some common CPR mistakes include not pushing deep enough, using the wrong hand position, forgetting to call for help, and not letting the chest fully rise between compressions. To sum it up, CPR is simple but powerful emergency skill that truly saves lives. By performing CPR, you keep oxygen and blood flowing until help arrives. And remember, anyone can learn to save a life. That's all for our discussion. Thank you for listening, and now let's watch a CPR demonstration for better understanding and visualization. I'm here to show you what to do if you see someone suddenly collapse and they don't seem to be responsive. The first step is to make sure the area is safe and that there's no danger to you or the person. Next, check if the person is responsive. Try talking to them and lightly tapping or pinching their shoulders. Hello? Can you hear me? Are you okay? Can you try to squeeze my hands? This person is not responding. The next step is to ask for help. In the Philippines, you can call 911 for emergency services. If there are bystanders, ask one of them to get the nearest AED or automated external defibrillator and bring it to you immediately. Next, we'll check the person's airway. Tilt their head back and lift their chin to open the airway. Check if there's anything blocking it. If there are no obstructions, check if the person is breathing. Look at their chest for normal rise and fall. Listen for breathing sounds and feel for air on their cheeks. If the person is not breathing normally, you need to begin CPR. To locate where to place your hands, draw an imaginary line from both underarms to the center of the chest. That is where your hand should go. Place the heel of one hand on the center of the chest, put the other hand on top, and interlock your fingers. Keep your arms straight, lean directly over the chest, and begin compressions. Push hard and fast, about a third of the chest's depth at a rate of 100 to 120 compressions per minute. Make sure you allow the chest to rise completely after each compression. If you are trained and willing to give rescue breaths, tilt the head back, pinch the nose, and cover the person's mouth with yours to form a seal. Give 2 breaths, each lasting about 1 second, watching the chest rise. 1, 2. Then return to the chest compressions and continue the cycle of 30 compressions and 2 breaths. Continue performing CPR, 30 compressions, and 2 breaths until help arrives, an AED is ready to use, or the person starts breathing normally again. That's all guys, I hope you learned something today. Bye!